It's John with Total Knee Coach, and what I'm going to show you now is one of the most important exercises that you need to be doing before your knee replacement, and it's going to help you figure out if you need to set up your home environment better. So this is going to have multiple functions that are going to be a benefit to you. My preference would be definitely to start doing this 6 to 8 weeks if possible before surgery, but even if you don't have that much time, this will be a nice way to know about how to set up your environment better. The exercise itself is very simple. It's literally just going to be standing up and then sitting back down. If possible, we want to work on this without pushing off with your hands. What that's going to do is make the quads and the glutes have to work towards getting stronger. As you can see, my knee is bending when I sit down. It's straightening all the way when I stand up. I can kind of lock those knees back, sit back down. This is a strength exercise, so we don't need to do a lot of repetitions. 5 to 8 repetitions at a time for 2 to 3 sets would be a good way to start working on this before surgery to get the leg ready for surgery. It works range of motion and real strength of the leg, so that's a good thing. Now, part 2, what I want you to practice before surgery is how can you get up off this couch or wherever you want to sit without really using your surgical leg. Right after surgery, you might not be able to bend your leg back this far. You might be having pain where trying to put weight or pressure through that leg is not going to work as good. So you need to know that you can get up no matter what. So what you need to practice is putting your leg out at about a 45-degree angle of the knee for the side you're going to have surgery on, and practice getting up and down using the strength of what's going to be your leg that's going to have to do all the work after surgery. Maybe you use your hands a little bit, but we can work on that. Couple things that does for you. Working on that can really build the strength of your non-surgical leg because it's going to have to do more of the work after surgery. Climbing stairs, standing up, sitting down, putting weight on it, the stronger your non-operative leg gets, the better. The other thing that does is make sure that if you need to modify your environment, you have time to do that. Either picking a different chair, different recliner, different couch to sit on, or figuring out a way to lift up the couch or the chair will make your life a lot easier after surgery if you know and can plan to adjust your home setup.